Hello, everyone. Thank you for joining us today. I appreciate it. It's a great turnout, so that's always good. If anyone doesn't know me, I'm Zachary Woodard. I'm the business official here at the school. I've been here about 12 years. To my left here is Kate. She works for Humana. That's Scott. He works for KBM. He's the broker. And over there is Jody, who is from Humana and knows way more information than I do. But before I let them kind of take over and give you the details of the plan, and again, you guys ask any questions you want. I want to just again reiterate the backstory of why we got here, because I think you guys all recall 3 years ago was when we first made this transition to a Medicare Advantage plan. I know there was a lot of apprehension anytime you have to change to something new. I think over the last 3 years, you guys realized it was a pretty good plan for most people, and that was generally the feedback we received as well. The interesting thing about this plan is we weren't looking to change whatsoever. It was a very quick turn of events that spiraled, and that's why we're here today. But back in October, we were notified by Excellus that basically the current plan they were offering was way underpriced, and they were looking at drastic increases. What does that mean? Specifically, they wanted to increase our rates 50% in January, which they did. We did not pass it on to you guys because we thought that was unfair. We told what the rate would be in July. We did not send an additional invoice for that. But that rate would be effective July 1st. That's one thing, right? To have a 50% rate increase, but then they couldn't really inform us of what the future increases would be. They told us where they wanted to end up, and it was looking at another 50% increase the following year. I have several reasons why I personally think it may have happened like that. Excellus at the time knew that a lot of districts in our consortium were breaking off to Medicare Advantage plans. It really did free up a lot of savings for the district. So again, I think Excellus kind of created this plan so they could keep the business, right? Clearly, after 3 years, we had no rate increases on the current plan, which isn't ideal, but that's what they did. And then I think they realized it wasn't sustainable, so they had to try to play catch up. So once we kind of heard that news back in October, our consortium had a couple meetings with KBM, and basically went out seeking other proposals. So what were our options, right? Could we have stayed with Excellus with the 50% rate increase? Sure. Could we have done another 50% increase the following year? I mean, that would have been drastic, right? So we did the RFP through KBM. We got a few responses. We got a few that said they didn't even want to quote this type of product, mainly because the plan is so rich. But what we ended up deciding as a group, consortium, again, all the consortium districts that had the Excellus MAP plan are moving on to a different plan. And that is what the Humana offering is. So again, once we found that out, I sent out the initial letter in December, let you know what was going on. A lot of things were in the works, and we also had to go to the consortium to actually have official approval to move forward. So now we're in that spot where, again, I think we found an equivalent plan with a couple extra benefits I think you guys will appreciate. So I'm sure you're not here to listen to me. So I'm going to kick it off to Jody, but I do want to say, Kate reminded me, if anyone did not get their enrollment packet in the mail, which is a pretty thick document, they were mailed out a week or two ago, and you didn't get one at the front door, she will, if you raise your hand, she will come around and provide you one right now. But again, this is a document that will be in the mail if you haven't gotten one yet.
You've got it.
So if you just leave your hand up, Kate will come by and give you one. And then I think Jody, if you're okay.
If you have this, yep, if you have this, you're all set. If you want something to follow along until you receive this in the mail, raise up your hand and I'll be right over.
Thank you.
Welcome.
Thank you, Kate.
You got it.
Again, that's please. Not used to talking on a microphone. I can't click and use the microphone at the same time. Well, good afternoon. Thank you for having me. Zach said, my name is Jody Haywood. I'm with Humana. I'm from Louisville, Kentucky. I'm going to give a presentation and then I'm going to sneak out of here and let Kate and Scott answer your questions. I'm trying to get to Syracuse to go. I'm about to get home tonight, so we'll see if we make it. I think I have like 20 minutes, so we'll see. So we're going to talk to you about your plan today. First, we're going to talk about Medicare. Medicare is clear as mud, right? They make it so easy for you. We're going to talk about your plan and how it works for you. We'll talk about enrollment and what you have to do to enroll. And then we're going to talk about what you expect after you enroll in the plan. And then last but not least, we're going to talk about all the extra benefits and resources that are available to you on the plan at no additional cost. So let's talk about Medicare. Medicare and how it's different from Medicare Advantage. So we know Medicare is a federal health insurance program for those that are 65 or older, or if you're on disability and under 65. And it includes original Medicare Parts A and B. A is your hospital, B is your doctor, all your doctor visits, outpatient care, your screenings and shots. Then you have what's called Medicare Part C. Part C is your actual Medicare Advantage plan. So in that Medicare Advantage plan, you have everything in parts A and B, plus with this plan, you have Part D, as in dog, which is your pharmacy, and that makes up Part C, your Medicare Advantage plan. So there's a couple of options, different ways to get your Medicare. So you may have a neighbor or family that has a different plan than you. So one way is to have your original Medicare. And then with your original Medicare, you have to have a Part D plan, right? Or the government penalizes you. So you would have your original Medicare plus your RX plan. And then if you wanted to put medical with that, you would have to have a Medicare supplement added on to that. With this option, you can have up to 3 cards. So you have 3 cards that would have to process your claims. With the Medicare Advantage plan, what's nice is you just have your 1 card because you have your A, B, and D all included in one. A little bit about Humana. So we actually started off in the nursing home business. We've been dedicated to communities around the country for over 30 years. We have 8.7 million Medicare members. And we have a nationwide network of providers. So I know a lot of you may go somewhere warmer for the winter. So if you're there, still a nationwide network of providers, no matter where you are. And then we've been providing Medicare plans to Medicare beneficiaries since 1987. So we've been around just a little bit.
So let's talk about your plan. So your plan, as I said, is Medicare Part C, your Medicare Advantage plan. And this is a picture of your ID card that you're going to get in the mail. Your plan is a PPO. Your PPO is Preferred Provider Organization. So with your plan, you have the same in and out of network benefits. So even if you go to an out-of-network provider that accepts Medicare and is willing to bill Humana, you'll have the same cost share as you did if you're going to an in-network provider. You'll have no copay for your preventive care, the out-of-pocket maximum, and you do have worldwide emergency coverage. So if you go out of the country, you can have up to $100,000 per occurrence when you're out of the country. And how this works, obviously we don't have a network out of the country. You would pay, and then when you got back, you would submit for reimbursement. So let's talk about your PPO plan. Like I said, you have the same benefits in and out of network. Not a lot to talk about here because you see all zeros on the screen. No annual deductible, your out-of-pocket maximum is 0. If you're admitted to the hospital or you have an outpatient hospital procedure, $0 copay. If you go to a specialist or your primary care, it's still $0 copay. Outpatient ambulatory surgical center and your durable medical equipment, also a $0 copay. Emergency room is a $0 copay, as well as your urgent care. With your plan, you do have some extra benefits with hearing, vision, acupuncture, and allergy testing. For your hearing benefit, you'll get your 1 routine hearing exam at no cost per year, and then your follow-up visits to your hearing provider also, 1 per year at no cost. And then there's 2 different levels of hearing aids. The first one is called the advanced level, and that's a $499 copay, and that's per hearing aid, per ear, per year. The next level is the premium level, and that's a $799 copay per hearing aid, per ear, per year. Your vision coverage, you get your routine exam, your 1 per year at $0. And then you get a $175 combined maximum for your refraction exam. And then you also get a $100 combined maximum towards contacts, lenses, things like that, and includes scratch resistant and UV protection. I'm going to go back one second. I forgot to tell you about the hearing provider. When you do use a hearing provider, you use the True Hearing Provider Network. So they must be in the True Hearing in order to get this benefit. And the same with the vision, you have to use the iMed network. That is the network you would use for your vision benefit. Acupuncture is 50% of the cost, up to 30 combined in and out of network visits per year. And then you also have a $0 copay for your allergy testing. So as I mentioned, your Medicare Advantage does include your Part D, your prescription drug plan. This includes all medications that are covered under Medicare, generic, brand, and specialty drug coverage. And you'll have access to mail order pharmacy, which I'll tell you about. So just as our providers I told you about, we have a nationwide network also of pharmacies. So again, no matter if you're traveling, if you go somewhere for the winter, we have a nationwide network of pharmacies. This includes all your big, brand name pharmacies, your Walgreens, your CVS, all your big grocery stores. This also can include some of your regional and some of your local pharmacies. So not all local pharmacies will be included, but there are many that are. So you would just get on, and I'll show you how to look up a pharmacy to see if you have your local pharmacy in network. Like I said, it's generic brand specialty drug coverage. And then due to the legislation that passed last year with the Inflation Reduction Act, all vaccines on the Advisory Committee of Immunization Practices are going to be $0. And this does include the shingles shot. You already have a $0 copay, but just so you know, this is what the legislation says. Also, with that legislation, the Inflation Reduction Act, anybody that takes insulin will never pay more than $35 for their insulin per month. Your benefit is better than that, but say you have a family member, a friend, or somebody, and you were talking about this, now you know, due to this Inflation Reduction Act, no one will ever pay more than $35 a month for their insulin. So your prescription drug benefits. With your plan, you have a $1,000 out-of-pocket maximum for the year. And on your plan, you have 4 tiers of drugs. You have Tier 1 generics, Tier 2 preferred brand, Tier 3 is a non-preferred brand, and Tier 4 are your specialty. I'm going to talk to you about 2 ways that you can get your prescriptions. One's going to be at the retail pharmacy, and one's going to be through mail order. So if you get a Tier 1 generic medication at your standard retail pharmacy for a 30-day supply, it's a $2 copay. If you get that Tier 1 medication through your mail order pharmacy for a 90-day supply, it's also a $2 copay. So a little bit of a cost savings there. And again, for your Tier 2, $9 copay, 30-day supply at your retail pharmacy, and also $9 when you get it through your mail order and a 90-day supply. Tier 3 is a $10 copay for a 30-day supply at your pharmacy, and $10 when you get it at a 90-day supply through the mail order pharmacy. Tier 4 is your specialty, and that's only going to come in a 30-day supply. We do not send those through the mail, and that's a $10 copay. Centerwell is Humana's mail order pharmacy. This is an actual pharmacy that exists. There we have 2 pharmacists that checked every order. Everything's very discreet, temperature controlled. You can get your email reminders or your reminders either by email, phone, text, however you choose. And this is great for your maintenance medications, right? And they only come in a 90-day supply, so you're not having to go get something mailed to you every month. But these are going to be your maintenance medications, the ones you take all the time. This is not going to be for something if you go get for a one-time use, if you have the cold or flu and you get an antibiotic. And once you receive your ID card, if you want to go ahead and set up your Centerwell account, you can do that. Once you get your ID card in the mail, even before your plan starts, you just can go onto CenterwellPharmacy.com and do that, or you can call the number. And all of this information is in that enrollment packet that you have also. There are 2 different ways that your medications are billed. One is under Part B, as in boy, which is your medical, or Part D, which is your prescription drugs. Part B, your medical, is going to be all of those prescriptions that you get in your doctor's office, at your provider, those injectable drugs. It could be diabetic testing supplies, insulin pumps, the insulin for insulin pumps, and your continuous glucose monitors are all billed under Part B. Now, I know you may get those at your pharmacy, but they're still going to be billed under your Part B medical benefit. Also covered under Part B is going to be some vaccines, and that's going to be your flu, your pneumonia, hepatitis B, rabies, and tetanus. Even though you may get those at your pharmacy, they still will bill under your medical benefit. Nothing that you have to do, your pharmacist will know how to run it through. But just in case you're like, oh, well, this time it didn't cost me anything. Last time it cost me a $2 copay. So you might, now you know the difference of whether or not it's billed under Part B or Part D. So everything under Part D is going to be your diabetes medications, insulin administered with syringes or pens, all those also supplies that you need for your diabetes, and all your medications that you pick up are going to be billed under Part D. And then the vaccines that are covered under Part D are the shingles, Tdap, hepatitis A. And just so you know, we do not make up the rules for what gets billed under Part B or Part D. We just follow what Medicare tells us to do. Again, it's clear as mud, right? I can't tell you why. What's the difference? Enrollment. What do you have to do to enroll? You don't have to do a thing. The district is going to get your information, and they're going to automatically enroll you into the plan. Now we're going to talk about what you can expect after you enroll. So you're going to receive a confirmation letter. So once the Centers for Medicare and Medicaid Services accept your enrollment, you're going to get a letter from Humana saying you're accepted. You're also going to receive your ID card in the mail. Your ID card comes in a long envelope, okay? So be on the lookout for that probably mid-June. A lot of these get thrown away sometimes. We can always get you another one, but I just like to tell you to be on the lookout, so maybe we don't have to do that. Your evidence of coverage. The evidence of coverage is that really thick, when I say thick, I mean like this thick, that has all the details of your plan. We do not mail those out to every individual, but we send you a postcard that gives you information how you can view that online, or if you want one mailed to you, it'll give you that information on how you can have one mailed to you. Also, CMS requires Humana to ask new members to complete a health survey within the first few months, and on the postcard, it'll also have information on how you can do that. And then we have the in-home health and well-being assessment. And this is an annual detailed health review conducted in your home. It is by a third-party vendor, so if you should get a call from Signify or Matrix Medical, those are legitimate Humana vendors. And they do come to your home. It doesn't replace your doctor, but it's just a second set of eyes. This is an optional thing. You do not have to do it. Some people don't like for people to come in their homes, but it is good. So the best example I have is sometimes there's a trip and fall hazard that you might not think about because you've lived there for so long and you don't realize. So they just kind of do kind of a little assessment, and then they can also, report back to your provider. It's just a good second set of eyes. But again, completely optional if you do not want to participate. We like for you to be able to stay connected and on top of your plan. So there's a couple of ways to do that. One is online. You can make your My Humana online account. With this, you can have access to your plan benefits, all your claims, everything you've done for the year or each month. You can see everything. And also, on the go, you can use your My Humana mobile app. And I think the best thing about the My Humana mobile app is it's going to have a picture of your ID card. Who's ever gone to the provider and forgotten their ID card? Me. So it's there. So it's a great way to stay in touch. You can look up pharmacies, you can look up providers, you can see your claims, you can see what prescriptions you've had. So it's just a great way to stay in touch. We also just like to remind you the importance of having a primary care provider. Somebody that you trust and can count on when you're sick and when you're healthy, if you need advice. So I'm sure a lot of you have a primary care provider. If you don't, we just encourage you to have one that's always going to be there for you. If you need to go, maybe a recommendation to another doctor, someone that you really trust and can count on. So I know I said that you had the same benefits in and out of network, right? But sometimes you want to know if your doctor's in network. So you can go to humana.com/find a doctor. When you go there, you'll have to enter the zip code. You could enter your zip code. So if you're at home and you want to find a doctor, the maximum search radius is 100 miles. So you would put your home address and search there. But say you're in California on vacation and you want to find a provider, you're going to look up the zip code of the location you're at. You're not going to put your home zip code. You're going to put the location of where you are, and then you can do a search that way. So it's just important to be sure to put that correct zip code in there. And then if you're already signed into your Humana, then you can look up a provider that way. You don't have to be signed in. So you can go to your coverage type, which you're going to choose. It'll say medical, vision, pharmacy. So you'll just choose which provider you're looking for. And then you're going to choose the Medicare or Medicare Medicaid option. And then you're going to select your network. And your network is the Medicare PPO. Once you do that, you can search by specialty, condition, or you can just do an overall search. So you can really narrow it down. You can put the exact provider's name in there. So it's a great way to search to find providers, pharmacies that you need if you want to see if they're in network. Telehealth visits are available on your plan. I know we're not using telehealth as much as we were a couple of years ago during the pandemic, but they are still available. If your provider offers telehealth visits, then you can use your plan for that. And again, since you have a $0 copay, that would be your cost share. This is really great, I think, for when you have the cold or the flu and you just don't feel like going to your doctor's office and you know that you just need an antibiotic, so you can still use telehealth. That is available to you. Continuous glucose monitors and supplies are covered on your plan. And you can obtain those either through your durable medical equipment provider, and the two that we have in our network are CCS Medical and Edwards Healthcare. But new this year, you can also get your CGMs at the pharmacy, which could be more convenient. When you do pick these up at the pharmacy, you still are going to need a prescription from your doctor. You can't just go in there and say, I need a CGM. So you'll still want to just have that prescription, or your doctor can call in and let them know that you're going to be picking up a CGM. So it could be a more convenient way. Your diabetic testing supplies that are covered under your medical benefit are going to be the Centerwell True Metrics Air by Travidia, the AccuCheck Guide Me by Roche, and the AccuCheck Guide by Roche. Smart Summary. So your Smart Summary is a personalized benefits statement. I like to say it's like your credit card statement. It's going to have a detailed view of everything you've done in the month. So if you've gone to the pharmacy, if you've gone to the provider, it's going to be all detailed out, and it'll roll through the year and kind of have everything you've done through the year. Now, if you have not picked up a prescription or you have not been to a doctor or any type of provider in a month, you're not going to receive a Smart Summary. So you have to have had a claim in a month in order to receive your Smart Summary. So sometimes people are like, well, I haven't received my Smart Summary. And I said, well, have you been to the doctor? Well, no, I haven't been anywhere or picked up a prescription in a couple months. Well, that's why. The next time you have a claim in a month, then your Smart Summary will come, and it'll still have that detailed of what you've done for the year. All right, so this is my favorite part. This is all the good stuff that comes with your plan, all the extra benefits and resources that are available to you on your plan at no extra cost. The first one being Silver Sneakers. And this is going to be a membership to a gym at no cost to you. It's very easy to find a location for Silver Sneakers. If you go to silversneakers.com, at the very top, you can put in your zip code. It's going to spit out all the locations that are available. This is great for so many things, because I know the YMCA, you can do group fitness classes. They also have all kinds of social outings. So we like to keep you involved, mind, body, spirit, all the way around. So this is a great way to stay involved. You can have more than one membership. So say you have two different gyms that you like that both participate, you can have a membership at both of them. And if you do go somewhere for the winter and you have a gym that you like there, you can also participate in that one. So there's no limit to the amount of gyms that you can participate in. You're going to go to that gym, you're going to show your Humana ID card, and then they'll give you a Silver Sneakers card. If you don't have access to a facility and you still want to do something at home, we have what's called Silver and Fit, and that's going to information is going to be in your packets, but also online at silversneakers.com. You can get a little kit that's mailed to you. It has some bands and little sliders, and then they have a menu of different things that are available, different programs that are available that you can watch online and follow along to. We also have Go 365, which is our wellness program, and we reward you for doing healthy activities. And this can be for getting preventive services, for walking, doing volunteer activities. And once you earn rewards, then you will get gift cards. So we reward you with gift cards. So once you've earned $10, you can start redeeming your gift cards in the Go 365 mall. If you've registered on myhumana.com, and then you go to Go 365, it's going to be the same login that you logged into your myhumana.com. We have a lot of educational, clinical support services that can help you. One being Humana Care Management. This is going to be a care management or one of our Humana nurses that will help you through discharge or medication therapy management. Say you have several providers, you've gotten several medications, you just want to make sure that you're taking them all properly, that there's no interactions. One of our nurses can help you with that. There's also behavioral health care coordination and consultation and health coaching. Post-discharge services. I think this is such an important extra benefit for your population, just knowing personally how important it is. If you are being discharged either from the hospital or a skilled nursing facility, you have access to 12 one-way trips by car, van, or wheelchair accessible vehicle to take you home from the hospital or facility you're at. And then also if you need to go back to a follow-up visit. My best example of this is if you've had knee surgery and maybe you're in a wheelchair and you don't have a wheelchair accessible van to get you home. This is a great service for you to use, and it's at no cost. Also, you have access to personal home care when you're discharged from the hospital or skilled nursing facility. And this is going to be for a minimum of 4 hours or a maximum of 8 hours of skilled nursing, up to 8 hours per day. Up to 8 hours per discharge. So you'll have a qualified aide that can come in the home. They can help with all kinds of things. They can help you, they can do some light housekeeping. They can help you maybe read through your discharge papers if you have a lot of instructions, help you with your medications, do some activities of daily living if you need help showering or things like that, or you can't get around. Say you had that knee surgery, you can't get around. So this is also just a great extra benefit that is available at no charge. Also, we have the Humana Well Done program. This again is if you've had an overnight stay in the hospital or skilled nursing, you can have access to 24 meals, 2 meals per day for 14 days delivered to your home. And we do have different meal plans, so if you have any dietary restrictions, this extra benefit is the most popular benefit. I get comments, compliments all the time about what a great extra benefit this is. So again, if you can't get around when you're at home, you can't make your own meals, this is a great way for you still to eat. We all need to eat, right? Anyway, this is just a great extra benefit that we have. We also have an advanced care planning tool that's online. It's called My Directives. And this is just a place where you can put everything online, put all your providers, your doctors, your wishes, everything all in one place. So in case you do have to go to a facility or if you're in the hospital, then your loved ones know where everything is and it's all in one spot. So this is my favorite extra benefit. It's the wellness coaching. Who here would like to have a health coach besides me? Someone that holds you accountable. So if you just want a simple plan of, hey, I want to start walking, or I want to start eating better, or any type of program, then you'll have a health coach, which again is one of our Humana nurses or care management professionals that will help you develop a plan. They can hold you accountable if you want or not. But anyway, I just think this is a great extra benefit, something that I would definitely wish I had on my plan. So there's many other clinical programs and resources that are available to you. I mentioned the case management, helping you through the discharge process, disease management if you have a chronic acute illness and you need help managing that. Our Humana nurses are just wonderful people, and I hear all the time just how great they are. The best advice I got a long time ago was to say if you ever got the phone number from a Humana nurse, if you speak to a Humana nurse, they'll give you their phone number. Keep that. They're just a great resource. They know of all kinds of programs that are available out there. So be sure if you ever talk to a Humana nurse and get their number, be sure to keep that. Transplant management, if you should ever need a transplant management, we have a team that stays with you from beginning to end, the same team. It's great if you should ever need that, hopefully not. And then just again, I can't tell you enough about our nurses. So they just offer a lot of guidance on everything you need and provide a good link between the members and staff. So we just have a whole variety of clinical programs that are out there that you would never know about sometimes if you didn't talk to a nurse. We like for you to be able to stay connected to us, so there are different ways to do that. You'll see throughout your enrollment kit, there's all kinds of numbers and ways to stay in touch with us. My Humana, as I said before, either online or through your My Humana mobile app is a great way to stay in touch. Or also, we have a dedicated group Medicare customer service number, which is the number on the back of your card. That number is dedicated to group Medicare members only. If you do have an escalated issue, what you would do then is you would get a hold of the district. The district would then contact Humana, Scott, one of us, and then we have an account concierge that's dedicated to your group, and they will reach out to the provider if needed and reach back out to you with resolution. So if you do have an escalated issue, it would start with the district and then it would flow through that way. But they will personally reach out to you and let you know the resolution. So I know I've told you a lot of information today. Like I said, everything is in your enrollment kit, everything that I've gone over. So we have time for questions. Yes, sir.
Take the mic. Do we want to take the mic to the people? Yeah, if they need it. So everybody can hear it?
Both my wife and I got the packet, and you said that the district enrolls. We don't enroll. Is that what you said?
You both got the packet and what?
This packet here.
Uh-huh.
But the district will enroll me. I work for the district. Or do we enroll?
No, the district will enroll you. You don't, if you're already in the plan, they'll just automatically enroll you.
When the cards are sent,
Uh-huh.
will both my wife and I?
You will, everything is separate. So you will get a separate card in an envelope, and then your wife will get a separate card. Yes, everything on Medicare is separate. You're each individual. You're not together. Yeah. So good point. You will each get a separate card. If you're a spouse, each of you will get your own card in a separate envelope. I'm going to come to you. I don't hear very well.
Do we have to contact all the doctors and nurses and whatever that we visit?
You do not. He asked if you need to contact all the doctors and nurses that you visit. So what you would do is next time you go visit them, you're going to show them your Humana card.
Do we follow up with that?
Yep.
In your packet, it says that you have to, you have to cancel your previous,
You do, no.
will that be automatic?
Yes, the question was, do you have to cancel your previous? No, you cannot be enrolled in 2 Medicare Advantage plans at one time. So once you're enrolled in the Humana Advantage plan, it automatically kicks you out of what you're currently in.
Another question. It refers to the several things need pre-authorization. Could you expand on that? And what is the time frame to get a pre-authorization?
So that information will be in your kit, and it also is in the evidence of coverage if you want to get that. But if you have do you have a standing pre-authorization right now, or if you're just asking if you need one? You don't have a pre-authorization that you have right now?
No,
Okay. Yes, for certain procedures you are, and your provider is going to know. He asked about pre-authorizations. There's a whole host. I mean, it just depends on it. Surgeries, everything that you do today on your plan, it's going to be the same. They follow the same rules. We follow what Medicare says we have to use a pre-authorization for. So any surgeries you have, things like that is going to require a pre-authorization. You don't have to do anything. Your provider will take care of that for you. Yeah. But the standard time frame is 120 days if it's not an emergency. Yes, ma'am.
We go to Florida
Uh-huh.
for 3 to 4 months.
Yeah.
If our doctor down there takes this Humana,
Uh-huh.
are they considered in-network or out-of-network?
So she says they go to Florida, and if their doctor in Florida is, she wants to know if they're considered in and out of network. So they could be considered in network if they're in Humana's network. If they're out of network, that doesn't mean that you can't go see them. You would just want to make sure that they accept Medicare and they would bill Humana.
Okay, I have another question, and perhaps this gentleman answered it, but I'm not sure. We now have Express Scripts. Do we cancel Express Scripts, or does this program cancel Express Scripts?
You cannot still use Express Scripts. No, you would use Centerwell Pharmacy. So you will have to have, your doctor can transfer those over. And so you don't, you can just call your doctor and they can just call the prescription in to a Centerwell. They do that? Mm-hmm. Yeah.
Thank you.
You're welcome. Uh-huh. You want me to come back if you think of it? Okay. Yes, sir.
Give us some examples of what requires pre-authorization?
It's, like I said, they're going to be pre-authorizations. They're going to be surgeries. Any surgery that you have is going to require a pre-authorization procedure, any procedure. Yep, you have to go in the hospital, yeah. It's the same as you have today. So like I said, it's a Medicare rules of what requires pre-auth.
So I've got bad pain, they go in, I see the doctor, he says, you need an MRI. I have to get 120 days later again?
So it's just, that's a standard. You don't have to know. If it's something that you need, then it'll be quicker than that. But that's like, if you schedule out a surgery, that's more like of 120 days, because unless it's an emergency, then it's expedited.
So if you need a hip replacement, it's 120 days?
Unless you need it like tomorrow, then it could be expedited. Yes, yes. And your doctor will know that. Yeah, yeah.
Hey, Jody, could I say something real quick? Jody, can I say something real quick? So I heard there were some questions about rates, and I was talking about increases earlier on. So I didn't want to scare anyone, but I just wanted to be transparent with what the rates actually are going to look like. So currently, through Excelis, with the current plan, previous to the increase, we were paying $290 a month. And that was the 100% of the cost. We know you guys pay a percentage based off of whatever you retired at, right? But the cost of the plan was $290 a month. Excelis increased that to $435 a month in January. The Humana rate is around $370. And so what we're going to do the next few weeks, normally you get the invoices the first week of July. I'm going to try to get those out a little bit earlier so you guys can see what the actual invoice will be. So it is going up, but again, under Excelis it would have been a 50% increase. With Humana, it's around a 25% increase of the plan. The good thing about, again, this transition, I know rates are going up, but Humana also locked in the second year rate increase at only 2.5%. So really, we're looking at a pretty stable rate for 2 years. What was the second year? A 2.5% increase. So I just wanted to throw that out there because I didn't want to, again, mislead anyone. But please, Jody, continue.
I was just going to ask that question, but would we be able to pay monthly?
Oh, yeah, there'll be no changes in payments. So I normally send out the invoice and the letter of how you could pay monthly, quarterly, annually, however you want to do it. No changes.
You said, are we automatically accepted?
Yes, yeah, as long as you just have to have your Medicare A and B. Yep,
What about pre-existing conditions?
there's no pre-existing.
Ask a question for Zach.
Yeah, go ahead.
The other schools in the consortium, are they going to a different plan or?
Yeah, so they all had the option to join this Humana plan, or go out on their own and try to seek something different. So again, I think this presentation was tailored for us, Shenango Valley and Oneonta. So we're three districts that have a very similar plan that is what's going on in the consortium. But again, our plan is so specific that there's still other consortium districts that are going to Humana under a different type of plan.
Yeah, question?
The diagnosis of sleep apnea requires CPAP machines. Are they and all supplies are covered? Yes.
That would be through your durable medical equipment provider, and that would be zero cost. Yes.
Thank you.
Good gentleman.
So do you have an estimate, what it's gonna cost? I mean, like a dollar amount?
Well, again, I think if you know what percentage you typically pay, it's gonna go up slightly. But, so say you pay, again, I don't wanna throw out any numbers. It's going up, but it's going up substantially less than it would have been under Excellus.
Depend on when you retire, you love.
The percentage.
Yeah, it's whatever contract you followed in when you retired, but whatever you pay percentage wise, it's still gonna be the same. You know, how the new bills will be.
Everybody's might be different.
Correct. Yeah, that's why I don't want to throw out just one number.
So Zach,
Yep.
the $370 a month, that you said that's the full cost, so then we can do our own math, whatever percentage.
That's per a month. Yes, per month. It's about 370.
I think she's consulting.
What's your question, sir?
So you don't have to worry about the donut hole or any of that.
Yeah.
Just $1,000, that's it.
Can you repeat
You want to take over?
Yeah. So this question was, do you have to worry about what's referred to as the donut hole, which is sometimes also referred to as a gap in coverage on your pharmacy benefit? And the answer to that is no, you do not. Your pharmacy benefit will work exactly the way it works right now with Excellus. It's a $1,000 out-of-pocket maximum.
I'd also like to add that you can fill a 90-day supply. You don't have to use the mail order. It's the same co-payment if you do a 90-day supply at the retail pharmacy, which is a one-time co-pay. 30-day supply at the pharmacy is going to be the same cost as a 90-day supply. So if it's a maintenance drug, obviously it's advantageous to fill it with a 90-day supply.
So you say we can do that through the pharmacy and not have to be through the mail?
That's correct. Has there been any consideration for ambulance costs?
For ambulance cost? What do you mean?
If you have an episode, you need to have an ambulance to take you to the hospital.
It'll be covered, yeah.
That is covered. Depends on, does it depend on the vendor? Because some ambulance companies in small
No,
towns don't.
No.
No, we actually did run into the same question with another district. So apparently there are some ambulance companies, private ones in this area that don't like to bill insurance. Unfortunately, that could be a problem, right? So you would probably have to pay that ambulance up front if that's what they're requiring, and then you could file that claim with Humana for reimbursement.
But in an emergency, it's always covered.
Right, but the ambulance company still has to be willing to bill the insurance company, and that's what they run into down here, is the private ambulance companies refuse to bill insurance, period.
Oh, okay.
And I think it's all insurances. I don't think it's, you know, Humana or any company specific.
But you are covered. It is a covered benefit. Joyce?
You said the CPAP machines were covered under the durable medical equipment provider, and who is that provider?
those providers, the durable medical equipment is, Edwards Healthcare and CCS Medical. It should be in your, somewhere in there.
And,
I can
and
put it
again,
back up on the screen for you if you want to.
yeah, so those are the preferred providers and network providers with Humana, but out-of-network benefit is gonna be the same cost sharing, so you can get your DME out of network as long as that DME provider is willing to bill Humana.
I know this is a lot of information right now, so what I think we're gonna do at the district level to try to make it a little bit more concise. We currently have, some information listed on the website for the Medicare Advantage plan under, Excellus. We're gonna obviously remove that, but we'll start adding, on the website, additional links and more information for what they provided to you guys today, to try to make it a little bit easier, to navigate. And again, if you have other questions, obviously contact Lori over here, contact us. Again, I think once you have your card, there'll also be that, number from Humana that you can always ask about.
And I just want to add, please know that we're taking this very seriously. It was a shock when we found out about the rates for Excellus and the fact that they could not promise anything but further hikes in the next couple of years. So everybody in our consortium looked very, very seriously at what we could get to be the best package for all of you. I gotta tell you, right behind you. You know, it impacts all of us, and we take your health care very seriously. There's going to be, I'm sure, some, you know, I know, I was just talking to Pat, and Pat said, even though you say you don't have to tell your doctor that you've changed insurances, every doctor's office posts and says we need to know that as soon as you walk in. So there are going to be questions probably you're going to have to answer, some things that we're going to have some conversations back and forth between Zach's office and you. But please know that we're going to support you, and we want to make sure that this goes as smoothly as possible and that you get the best benefits that you can. What we've heard from other districts is that they've been very happy with Humana. Some have used Humana all along, and they also said that because it's a national company, that when you travel, it can make life a lot easier. So we're hoping that this choice was the best choice for everybody, and that it's going to be a really smooth transition. But we will definitely be in communication and be working with you on this. Are there any other questions before our Humana people finish up here?
Just to piggyback on what was just said, we have a whole team of people behind the scenes who can help with questions, with researching. If you have a surgery scheduled for early in July, anything that you're concerned about, reach out, let us know. We will get on it. If you have a doctor that you've reached out to who says they are not in network and they will not bill Humana, let us know who that provider is, because we have a team of people who will reach out directly. Sometimes it's just a matter of not understanding how simple the process is to just change the address where the bill goes. So we want to make sure that we're here to help you with that. So definitely reach out and let us know. Customer service, the number that's in your booklet and will be on your ID card, they know you guys are coming. So feel free to give a call at any time to reach out with any questions, and they will, they'll know that you are coming on board with us for July 1st.
Jody, if we do call this customer care team, do we get a real person or do we get voicemail from the health?
You get a real person. Yeah.
Then lastly, I'd just like to add that I have a flyer up here. Anybody's welcome to take one. This is a flyer that you could provide to your provider. It basically explains who Humana is. If they're not a network provider, show them this flyer, because it gives them details on how they would basically bill Humana for your services. It may make it a little easier for them to agree to bill Humana for you.
And there's a copy of that also in your booklet.
Oh. And we'll put it on the website.
And we'll put it on the website. Thank you, everybody, for your time today.
Thank you.